Okay, we are live now.
Okay, thank you and welcome back, everyone. This is a continuation of our earlier meeting with the superintendent.
If we still are producing record.
I want to thank everyone for returning. For those of you who are just joining us, we have a few administrative announcements to make. We are live. This is a continuation of the board's work session for the summer that follows a series of meetings that we had in the spring to better inform us about the challenges we face with the blueprint and to share with the public some of our ongoing concerns. We are attempting to identify a series of issues, challenges, timelines, tasks that we have to perform throughout the summer in preparation for a comprehensive plan that we hope to have and we will have by December the 2nd. Today is our discussion on Pillar 1, and we'll be led by board member Jennifer Lynch. And we have probably some of our advisory board members who are with us today as well. I'm not sure quite who's here, so Joe, why don't you identify some of those who may be a part of this afternoon's discussion?
Absolutely. We want to thank the following advisory committee members who have registered for this meeting. Hopefully that they are here to participate. And if you are here, if you want to just turn on your camera just so everybody can see you. But the advisory committee members who have registered for today's meeting is Ruby Daniels, Jacob Bennett, Cara Burhans, Gina Hoover, Raina Miller, Jaden Ferris, and Samaya Rahman. So thank you to all of you who are here participating in our working group sessions.
Okay, Rachel, who are the board members we have be with us today? Good afternoon.
We have obviously Mr. Manko, Vice Chair Kerwin, Board Member Lynch, Dr. Stapleton, Mr. Harris, and I'm not sure if Dr. Doss has been able to join yet or not. I don't think she has.
Thank you. In order to ensure full participation, I hope that you would follow the guidelines and protocols that Rachel will outline for you in just a moment. But these meetings are designed, in my opinion, to provide us with as much participation as we can manage through this process, to have a level of transparency so that we can ensure that everyone is fully apprised of what we are doing and what we hope to do in the foreseeable future. One of the challenges that we have, given such a large meeting, that we will not be able to comprehensively go through everything today, or we simply may identify issues that we hope to bring back to you at a later point. And so it may mean that we will pass on some of these issues to a smaller group. That smaller group would work through some of the details, bring it back so that everyone could have a full understanding of where we are and the decision that we will make consistent with what we find in the smaller groups. Today's discussion, again, is designed for us to deal with Pillar 1. But one of the things that we are trying to avoid, that is to ensure that we get this done in a timely manner, is that we are not here to relitigate the blueprint. It is not to suggest that the blueprint is perfect. There are issues and concerns that we've identified and others have identified. But for us to make a change in that, we start with the presumption that the blueprint is the legislative intent of the General Assembly, and that we are to honor that. If we are to change that, a very strong case needs to be made for us to alter what is in the legislation at this point in time. There will be opportunities in the future, and hopefully it will not be too many whereby we go back constantly making changes. But there may be opportunities for us to do so, but we do not start with the presumption that we're going to automatically do so. Again, this is for us to go through Pillar 1 today. We have a couple other meetings that are scheduled, and why don't you give those dates for us as well, the follow-up, Rachel, that we will deal with some of the lingering issues from prior meetings.
Sure. Thank you, Mr. Chair. So first of all, let me welcome everyone and apologize because we have worked to lift the 100 participant cap on meetings, but apparently it was not effective. And so we are capped at 100 participants for this meeting. And we did have over 200 register. So apologies to those of you who are not able to join the Zoom meeting. Hopefully we're letting people know to go ahead and get on the General Assembly website. You can watch this meeting on YouTube. And please, if you have questions or comments, please email them to aib@maryland.gov. And we may not be able to monitor that as well during the meeting, but we will definitely note all of the questions and comments for follow-up at future meetings. So again, our apologies, and we will fix this. We thought we had. In terms of how we're going to work today, we're going to follow the same protocols as we have for the first two working sessions. So we ask that everyone who is on the Zoom to put your questions or comments in the chat box, and we will be monitoring that. Staff will be monitoring that. Dr. Lynch will be monitoring that and facilitating the questions. And also, of course, board members may ask questions in the usual way by raising your hand. And then Dr. Lynch or myself may call on you to come off mute and turn on your camera to either explain your question or add a little more context to your comment. And we would just ask that you be as concise as possible so as many people as possible can participate. We may not be able to get to every question or comment, but as I said, we are monitoring the chat box. We're taking very detailed notes, and we will be following up on every question or comment that is made. In terms of future meetings, this is the last working session for the first round of meetings on each pillar. Starting next week, we will start our second round of meetings for each pillar. And so on Thursday, August 4th at 1 o'clock, we will have pillars 2 and 5. On August 11th, we will have pillars 3 and 4. And at least tentatively, we're assuming we will need the second round of pillar 1 and on August 18th, and then potentially we'll be starting the third round on some of the other pillars. So we will make sure to continue to email out updates and post them on Twitter. And as soon as our website is available, that will be a very good place for you all, for the public to be sure about what's going on.
Okay, we're ready now for pillar 1. I think Emma is going to give us just a general overview, and then we'll turn it over to the facilitator for today, Jennifer, and we'll go from there.
Thank you, Ike. So we'll talk a little bit about pillar 1. Many of you are probably already familiar with this, especially if you've been joining us for the last couple of working sessions. This graphic shows the 5 pillars that are part of the Blueprint for Maryland's Future. And today we are focusing on early childhood education, or pillar 1. So I'm just going to talk a little bit about some of the components of pillar 1. First, an objective of pillar 1 is to significantly expand publicly funded full-day pre-K for all 4-year-olds and low-income 3-year-olds through a public-private delivery system that we'll talk about in more detail. The second objective is to increase the number of highly qualified early childhood education providers and educators. The third objective is to expand supports for young children and their families. to fully fund the Maryland Infants and Toddlers program, and to improve student readiness for kindergarten. So you'll see all of these in the graphic that we'll present in just a minute, and I will turn this back over to Rachel and to Jennifer.
Okay, we're ready to start, Rachel.
Thank you. So while Emma is putting the graphic on the screen, again, as the other working sessions have the format is, I'm going to go through each section of the document first, just to sort of familiarize everyone with the format, and then also with the specific additional information that we provided in this graphic. And then we will pause after each section and take questions and comments. So, Dr. Lynch, did you want to say anything before we start?
I think, Rachel, it might be helpful as we start to go through, if you can explain, as you have in the previous sessions, just what all of your graphics mean in the years in terms of the star versus the dot, so that people have that understanding as we get underway. It's written at the top, but for those who may not be able to see it as well, it might be helpful.
Absolutely. I will absolutely do that. And I will also, for the public, let you know that this document is posted with the other meeting materials on the General Assembly website. And you can download it and make it bigger if you need to. So again, this is Pillar 1, which is early childhood education. 1.1 refers to the first objective under Pillar 1, which is expanding publicly funded full-day pre-K. And then below that, 1.1.1 is the first task under this objective. And so you can see the numbering convention that's going on here. And then to the right is the implementation timeline, starting with fiscal 22, which was intended to be the first year of Blueprint implementation. And then going out to fiscal 32, which is currently the last year that the AIB is in existence. It is scheduled to sunset after fiscal 32. And so that's the timeline that we're using. The line, well, let me start with the stars. So the stars reflect deadlines that are in the law, dates that are specifically in the law. The yellow dots are estimated deadlines. So where you see a dot, it means that the law doesn't specify a date for implementation, but based on either the commission's timeline or the legislative intent, we have put yellow dots where that is the estimated timeline. That is something that can be adjusted depending on what the AIB and with the feedback of everyone participating, those can be adjusted without changes to the statute. The stars cannot be adjusted without changes to the statute. And then the lines indicate obviously ongoing implementation, with the arrow indicating that it goes on beyond fiscal 32. And you'll see in the fiscal 22 column, sometimes there are back arrows, meaning that that particular something related to that task or subtask began implementation prior to fiscal 22. So that would be as a result of one of the Bridge to Kerwin pieces of legislation that actually took effect prior to fiscal 22. So that's sort of the big overview. And
hey,
then,
Rachel?
Yes.
Yeah, so in that context, explain the dot on 1.1.1 in fiscal year 26.
The dot. Oh, I see the dot. let's see. That's a good question. I think that is.
Does that mean that by that date we should have preschool for all 3 and 4, low income 3 and 4? No.
No. So if you look at 1.1.1G, that is the subtask that addresses what you're thinking of, which is the point at which all 4-year-old, low-income 4-year-old children, and then low-income 3-year-old children would be served. So there is there is a dot there in fiscal 26 in row 8, but I think that dot probably should not be there, Emma,
okay.
Unless
right. I didn't mean to cause
no, it's okay. I think that is, it's more complicated to put the timeline for the entire task when there are different deadlines within the task, which is definitely the case with this.
Gotcha. Okay.
So I'm not sure that should be there unless,
and
it's gone now. So there we go.
Okay.
But what we've tried to do where we can is provide some sense of the overall timeline for that task. But in this case, there are too many different deadlines to be able to do that. So with that, I'll just go ahead and start walking through these subtasks. So the first 1.1.1a is the funding formula. So there's a new funding formula for full day pre-K as part of the blueprint. Fiscal 23 is the first year that formula is being implemented. And so that is the star in fiscal 23. And then it's an ongoing implementation. The back arrow reflects funding that has been provided since fiscal 18 to incentivize school systems to provide full day kindergarten for 4-year-olds. So there has been, as part of several pieces of legislation that we refer to as Bridge to Kerwin legislation, that has provided funding for full day pre-K. And so that is the back arrow there. And this new formula, starting in fiscal 23, provides funding for low income 4-year-olds. Low income is defined as family income up to 300% of the federal poverty level. And as the expansion of pre-K is phased in, additional students will be counted in the formula. But in the first few years, it is just the low income 4-year-olds who will be served, or low income 3-year-olds. So essentially the first priority for providing full day pre-K is low income 4 and 3-year-olds. In most cases, systems are still, really focused on the 4-year-olds and converting the half-day slots that they're currently required to provide. That has been required since the Thornton legislation, that half-day pre-K be provided for low-income students at a lower threshold of 185% of poverty. So many LEAs are focused on converting those 4-year-old slots from half-day to full day. But some LEAs are further ahead of the game and are able to start adding 3-year-olds, low-income 3-year-olds. And so that is the first phase of the formula implementation. And I'm just going to go down in order here. So 1.1b is priority for slots should be given to the 3 and 4-year-olds from low-income families, and also children with disabilities at any income level. That is one of the priorities of the blueprint, was providing those additional supports as early as possible for children with disabilities. And then also you can see homeless youth and children from homes where English is not the primary language. And that also takes place in fiscal 23. And then the yellow dot, it reflects the goal that low income, particularly low income 4-year-olds would be served by fiscal 26. And the next row refers to prioritization by the Interagency Commission on School Construction to provide public funding for pre-K space, and that be a priority. We know that it is a challenge for the there's not enough space in public schools to provide pre-K, and that is why, just to sort of bump up to the 10,000 foot level, Pillar 1 calls for a mixed delivery system of public and private providers. And that is in part to build on the provider community that is already in existence in Maryland. And then also recognizing that, this simply can't be done only with public spaces and public school systems. But there is a priority for school construction funding to go towards expanding pre-K classrooms. And then in 1.1.1D, this reflects the pre-K expansion fund, which is another source of funding available to support pre-K expansion. It is separate from the funding formula, and it predates the Kirwan Commission. It predates the blueprint, and it even predates the Kirwan Commission back to 2015, when Maryland received a very large federal grant to expand pre-K, full day pre-K. And so those dollars that the state had to match at the time have been continued, and they live in this, what we call the pre-K expansion fund, which is now being used under the blueprint to help, primarily to help LEAs convert half-day slots to full-day slots. Also, some private providers, but not very many, have participated in the half-day program. But then the other really important use of the fund in this transition period is to help support private providers coming into the publicly funded program, and providing grants to help them meet some of the requirements to receive the public funding under the program. Under the blueprint, the use of the fund for that purpose sunsets after fiscal 25. So the star in fiscal 25 reflects essentially the end of this funding source, specifically to convert slots from half day to full day, and to encourage private providers to participate in the program. And then under the blueprint, those dollars actually get rolled into the funding formula. So they don't go away. They're still going towards pre-K. They're just going to support the funding formula, as opposed to these separate pre-K expansion grants that MSDE administers. 1.1.E is something that was put in the law actually prior to the blueprint, which requires local health and social services departments to notify families that their children may be eligible for publicly funded pre-K services. And then 1.1.F deals with trying to leverage other funding sources that are available to support 3 and 4-year-olds by leveraging families who are eligible for the Child Care Scholarship Program, so that those funds can, the term of art currently is so that you can braid funding. So you can braid the pre-K formula funding that provides the full day program during the school day, and you braid that with Child Care Scholarship funds that can support the pre or before school and after school hours of childcare for families. And that also, the star reflects the fiscal 23 start date of that, tying with the new funding formula. And then the last item under this task, which again is just expanding access for the low income 3 and 4 year olds, is the timeline for serving all 3 and 4 year olds who wish to enroll, whose families wish to enroll them, because just to be clear, this is not mandatory full day pre-kindergarten. This is optional. But the hope is that many parents will participate with and enroll their children. So the star in fiscal 26 reflects the requirement. So it's in the law that all low-income 4-year-old children will be served by the fiscal 26, which is the 2025 to 2026 school year. And then the yellow dot reflects the commission's timeline that low-income 3-year-olds would all be served by fiscal 2030. That date is not specified in the law, which is why it's a dot. And it was going to be challenging to meet that before the pandemic based on the number of available providers and sort of the rate at which we thought we could grow the provider community. So I think that is probably going to be challenging depending on how school systems phase in the use of their slots. And I'll pause there. The next section deals with the sliding scale for the formula to incorporate not just the low income 4-year-olds, but also 4-year-olds from families of higher income. Actually, let me ask Dr. Lynch, did you want me to go through this whole entire pre-K expansion or just pause here?
I think, so when I look at what's happening in the chat, people have some questions, but that they seem to be a little bit more directed to 1.1.5. If we can just maybe pause at the end of every task and just give anybody an opportunity to ask any quick questions, I think that we're going to have a little bit more discussion when we get back to that expansion in 1.1.5. But anybody have any questions? It says there will be many counties that will not meet the 30% community-based pre-K and 50% share of state-funded pre-K required by the blueprint. Please examine how many waivers you receive and the implications. You want to talk a little bit about the waiver process?
Sure. So I'm wondering if maybe I should just keep going through all of this because the questions are not, they're coming in not in the order that.
Yes, exactly.
Yeah, so why don't I just I was trying to not sort of like, take all the time talking, but let me just quickly go through the rest and then we can just sort of work through the questions. Okay, so 1.1.2 then is the next task under our objective of expanding full day pre-K in a mixed delivery system. And so 1.1.2 deals with 4-year-olds who are above whose family income is above 300% of poverty. And so 1.1.2a refers to a sliding scale. So under the blueprint, the system is designed to provide more public funding for low income students. And then as a family's income increases, the public funding, both state and local funds, would decrease and the family share would come into play and families would start to contribute to the cost as well. And then when you get to 600% of poverty, there would be no public funding essentially, and the family's share would be picking up the cost. So that's the concept. And so the first under A there is MSDE has to design the sliding scale. There's a good amount of it in the statute, but there's also a lot that still needs to be worked through. And that's by July 1 of 22. And we can ask, when we get to it, we can ask MSDE to perhaps give us an update on where they are with that. And then the sliding scale will be implemented begin no earlier than fiscal 25. So the star there is in fiscal 25. And so you can see just a minute ago, I talked about that we want all low-income 4-year-olds enrolled by fiscal 26. So the sliding scale is allowed to come in the year earlier for those systems that might have already been able to enroll all of their low-income 4-year-olds and potentially some 3-year-olds as well. And the idea is to get an integrated classrooms that are diversified based on income, and not so that you it's not just we're not creating concentrations of poverty within pre-K classrooms essentially. And so that's 1.1.2. Then moving on to 1.1.3.
Rachel, can we just take a pause just for a second, because we do have a question about what is the sliding scale. So before we get too far out from that sliding scale, if you just want to discuss how what MSD is doing with that.
Well, this would be, is Stephen Hicks or someone from MSDE available to provide an update on the sliding scale?
Hi, Rachel. This is Ari at MSDE, and Stephen's here as well. On this, I will say Stephen will answer almost every question and not me in this whole interaction, except I will say this particular one. I did just want to give a quick update, which is that we'll drop a link in the chat to the interim report we did on the implementation of the pre-K work, which was required in the blueprint, and we'll reference a few times throughout this conversation. One of the sections in that report was an update on analysis of outlining 4 different options that we were considering at the time for implementing a sliding scale for Tier 2. And we also included some next steps there, which included doing some additional modeling of what the impact would be of each of the options that were outlined, and then doing some stakeholder engagement. We are in the process of that. We do not have, as many of you know probably, we do not have sufficient data in Maryland to do a full-scale analysis, and we are remedying that now. We are working on collecting data that, for example, matches family income to preschool-age children to pre-K enrollment. And so we are not at a point where we can make a decision that we feel is responsible until we get that data in terms of how the sliding scale will be designed. But we did outline 4 options, and we'll put a link to that in the chat, and we will definitely be doing stakeholder engagement as soon as we have more data and analysis done that we can do meaningful engagement around. And that will all be done on time to still be able to implement, on the blueprint timeline. Stephen, would you add anything to that I missed before I turn it back to Rachel?
No, I think that's great. I mean, the 4 different models that Ari talked about really have different implications depending upon the income level of families in Maryland, and we want to ensure there are no unintended consequences or hardships for families.
Thank you, Ari and Stephen. And I see in the chat the question about the amount for the sliding scale. Obviously, that's not ready for prime time yet, but I would refer you to the 2019 commission report. There is sort of an example of what the sliding scale would look like in terms of how it would sort of phase up as income phases up, and you can sort of, so it can give you a sense of what we're talking about if you're not familiar. But obviously the details are yet to be figured out.
Rachel, are we ready to move on to the next?
Sure.
item?
So 1.1.3 is a high quality mixed delivery system. And by mixed delivery, we mean providers who are both public providers, which are the LEAs, and also in some cases, Head Start programs, sometimes are, and then which are federally funded for the most part, and private providers who are primarily charging tuition of families in order to provide their services. So as part of the commission's work, they were very committed to this mixed delivery model and actually set minimum private participation rates for private providers in the recommendations, which were ultimately adopted in the law. And so the first minimum is actually for this current fiscal year 23. So that will be the 22-23 school year coming up. And that is that 30% of the publicly funded slots in each LEA or local education agency or school districts or school systems, they go by lots of different names, 30% in fiscal 23. And then the intent is that it phase up so that half of the slots being funded, publicly funded in each LEA would be private providers. There is a waiver provision in the law that allows the school systems to request a waiver from MSDE for meeting this minimum requirement if there are not sufficient providers available, and they've made efforts to recruit private providers into the publicly funded system. And that waiver process also would begin for the upcoming fiscal 23 or 22-23 school year. And I think you said there was a question about the waiver.
I think there was a comment just sort of identifying that there will be challenges for school districts to meet that mixed delivery number because of the available pre-K slots, if we want to discuss that. And then there's a clarifying question just asking by 2027, the expectation is that 50% of all children in pre-K will attend a private school instead of a public school. And so if you want to just sort of discuss the reasoning, it sounds like there may be a question behind the reasoning for the mixed delivery system.
So in terms of the 50% goal was that it be a public-private, essentially a public-private partnership model for the expansion of full-day pre-K for all 4-year-olds and low-income 3-year-olds. And so ultimately, the commission recommended that a 50-50 model where half of the slots were being provided by the school systems or public providers, and the other half were being provided by the private providers for a lot of reasons, including the taking advantage of the space and the existing provider community. And obviously if all of the slots went just to LEAs, first of all, they have to have the space for all those kids, which doesn't exist. And secondly, the providers would have a very hard time filling the revenue gap by no longer being able to serve those students. So it was trying to balance out the model, but at the same time requiring, and we're going to get to this next, that any provider, whether public or private, has to meet the high quality standards. The research has shown us that providing pre-K, if it is not high quality, does not have the staying power. And as students move from pre-K into kindergarten and into the early elementary grades. so that explains that. And maybe we could ask MSDE if they could say, if they want to say anything about the waiver process. I'm assuming that it's going to be difficult in fiscal 23 for possibly all of the LEAs to achieve that 30% minimum.
Sure, thanks, Rachel. So the waiver process is also contingent on enrollment, right? As you were talking about, this 35% goal for FY23, that 35% of 30% of the slots be in private provider settings. There are, and those are full day slots, right? Because that's what we're talking about with quality. So there are some school systems that have not, do not have very many full day slots. So in those school systems, you actually may have a higher percentage of private provider full day pre-K slots that are meeting those structural elements of quality that we know make an impact on child outcomes. What we have to do is take a look at the data of enrollment to do those calculations. I think this first year, some school systems will have met that, some jurisdictions will not, and we'll look at the data to determine that, and then we can have the waiver process in place. But no LEA has asked for a waiver yet because we don't have the enrollment data for this school year to do those calculations.
And Rachel, we had another question of how can we encourage private providers, LEAs, how can we encourage LEAs to partner with private providers in order to meet these goals?
So the LEAs are required to enter into memorandums of understanding with the private providers in their community and with MSDE. And that was done specifically to encourage them / require them to be in conversation with their provider communities and working to address the needs of the 4-year-olds and 3-year-olds in their LEAs. Stephen, I don't know if you want to, the MOU is actually, we're going to get to it because it's a whole task.
I can give you a short preview of that, kind of setting us up for looking at the requirements in the blueprint. But the school systems have need to have the MOU with their private providers that are providing pre-K under this program, not all private providers, just those that are participating, and that will increase each year. That's our goal. And they've submitted those MOUs, and our next step from the state level is to provide technical assistance on implementation plans for each of the jurisdictions. There are a lot of critical elements, which Rachel, I'm sure, will go through in just a moment. And for each of those, we're providing the technical assistance and guidance to each of the LEAs so that they can successfully craft an implementation plan. And we're doing that in this collaboration effort that was just mentioned. Those technical assistance sessions that will begin in August, those are for the private providers and, the school systems and their private provider partners to really build those partnerships. And we've already seen a lot of school systems thinking about this partnership and really reaching out to the private childcare community to build strong coalitions together.
And Stephen, another question came in asking, how will we let families know? Do you just want to take a quick second to talk about the new system you are developing?
Yes, so we are we provided some supports for each of the local systems on their a coordinated enrollment process, so that when a family comes to their local school or they contact their district, they can see which private providers are also being funded through the state and local partnership of funding for full day, high quality pre-K. We also have a long-standing collaboration with the Department of Human Services, and this is a requirement they have to post in their local social service agencies and share with families those various options for pre-K that are in that community. And then we will also be doing a lot of social media outreach, other kind of marketing strategies to make sure families and diverse families, multilingual families, families with children with disabilities, understand this opportunity for high quality pre-K in Maryland for 3 and 4-year-olds.
Very quickly before, I know we have to move on, but can you just let people know where they can find the dates for the technical assistance meetings?
That's a great question. We are still finalizing those dates, and we'll have those sent out soon to all the local superintendents, and then also make that available to the private child care community.
And Stephen, do you post those dates on your website somewhere? Do you have a...
That's a great question. Let me get back to you on that, where those are posted, so that you can have that information.
And
you muted, Jennifer.
I was just saying, I noticed that we had some board members who had some questions, so I was actually going to send it to you, Vice Chair Kerwin.
Oh, thank you. An issue that came to Rachel's and my attention the other day is one that we need to flag, I think. And that is a huge opportunity exists for partnerships with Head Start, because the goal is the same here. The difficulty is, as I understand it, Head Start is not allowed to enroll students who are between 300 and 600% of poverty. They have to stop at 300%. And that's a federal restriction. But it seems to me there ought to be some way to find a means of collaborating with the Head Start programs. Maybe we have to ask the federal governments for some sort of waiver or whatever, but and I don't know that there's an answer to that, but I just wanted to raise that issue, and I would certainly be pleased to know if anybody from MSD had any thoughts about how we could take advantage of Head Start to meet this demand.
Yeah, that's a great question also. I will say that in our pre-K expansion grant, which Rachel has said we've had for a long time, beginning with federal funding and then taken over with funding by the state. We have in FY23 4 Head Start programs that are participating in the pre-K expansion grant program, and that is about 273 full-day high-quality slots. And the idea is to leverage the programmatic aspects that Head Start has, particularly the family engagement, which is very high participation from families, as well as other elements of Head Start, and then layer on top of that, this is really that braiding that they do. So we have the Head Start funding and our state and local funding in the pre-K expansion, in the pre-K funding together, and that raises the salaries for teachers, which means we can attract really well qualified teachers for those programs. Of course, those teachers typically in Head Start aren't required to have a bachelor's degree, although more than half of them do. And they don't have to have a teaching certification. In the pre-K expansion grant program, they have to have a teaching certification or be enrolled in a teaching certification program. So now we have Head Start programs with teachers with teaching certification as they layer those fundings together. Mm-hmm. Some school systems that are delegates of Head Start have also an opportunity for different kinds of models. So at a school, you could, like in Montgomery County, for example, that has expansive Head Starts because they're a delegate, they could have a contained Head Start classroom, a pre-K classroom at their school, or they could mix those classrooms. So they could have, for example, 10 Head Start kids and 10 kids funded at that higher income level so that we have that mixed socioeconomic levels of families, which is one of the goals based on research that we know makes a big difference for all kids.
Great, Stephen. Thank you. That's encouraging to know that you're really on top of this, because it is a great opportunity for us.
Thank you. And Joe Manco.
Yeah, I just wanted to elevate some things that were put in the chat by Janine, just around primarily around the time frame, the I guess feasibility of the time frame for providers in order to meet requirements for accreditation for EXCELS. And then the second question that she elevated that I thought was also a good one is just the role of assistance, and if there's anything that can be done or has been done to incentivize and support assistant teachers within the provider community.
So
I can start with the assistance, Rachel.
Well, just hold on. I just want to say that we haven't actually gotten to those sections yet. So I'm not sure if we want to try to answer them now or sort of keep going. So Dr. Lynch, however you want to handle it.
Yeah, I've actually been, I've been sort of taking notes so that I don't miss anybody, so that when we get there, we can just take a minute, because I think there's a lot of good questions when we get there. So if we can continue on. And just one more thing that I do want to elevate. There was a question about how will we be making sure that we're specifically reaching out to our Latinx communities. And so I want to just take a moment for MSDE to share that information as well. And then I think we can go on to our next section.
Great. That's a good question, and something we are striving to get better at. We have a lot of a growing population of Latinx families. We, this past opportunity for expanding pre-K that we have for FY23, we held over 17 technical assistance sessions, as well as sessions with open office hours for private providers and schools. We also had a session for multilingual, mostly Spanish-speaking providers on not only the stabilization grants, but also the pre-K opportunity. And we partnered with the Latino Child Care Association of Maryland, and we intend to do a lot more of that early in the fall to get providers ready to expand in pre-K. We do have currently some Latino or Latinx providers that are participating, and we want to expand that opportunity so that families have culturally relevant and responsive opportunities for early education.
Thank you so much. Rachel, do you want to move on?
Sure.
And I do want to just do a little mindful time check for us. We have about 30 minutes left. So I know I believe the chair said at the beginning that if we do not get to everything today, we will be revisiting these conversations. So we will have an opportunity to continue to dive in future sessions, should we not get to everything today. But I just want to keep an eye on our time as well.
Absolutely. So the next section, the next task 1.1.4 is actually around the requirements for the MOUs between the school systems, the providers who will be participating in the publicly funded program, and MSDE. And so ultimately the MOUs will be part of each LEA's blueprint implementation plans that they'll be submitting next March. But obviously the full day pre-K program and the new formula are going into effect prior to the submission of these blueprint implementation plans. So sort of as a result of the delayed creation of the AIB and sort of the timing is off here a little bit. And so some of work that would have really been part of the implementation plan, blueprint plans that would then have gone into effect for the next school year, we're kind of off about a year. So that adds to the confusing and complicating nature of all of this. And all of these, you can see the yellow dot there. So all of these, the assumption is that the MOUs would begin in fiscal 23, which is what MSD is implementing. And then they would obviously be updated either through addendums or renegotiations in the future. So in 1.1.4b, the MOUs will provide for services for children with disabilities. We've talked about the priority for that. Above in the formula funding, and also wanting to make sure that again that we have classrooms that are socioeconomically diverse and also diverse in other ways. That there will be a process for parents to indicate a preference for a provider, either a location or a public or private provider. That doesn't mean that they would necessarily receive their preference, but an opportunity to indicate a preference. And then also the details, the nitty gritty of sort of how the funding will change hands between the state, the school system, which will have the local funding, the matching local funding that's required through the new formula. And then for the families at 300% and above, the family share that is going to be provided. So there's a lot of work that needs to be done to sort out how that works, as well as depending on how that's sorted out, whether there need to be essentially a set aside for administrative costs to implement the MOU. And then, as we've talked about a few times now, a plan for racial and socioeconomic integration in the full day pre-K classrooms. And Stephen, did you have, I think, a little more you wanted to add about the MOUs?
Well, I just do want to reiterate that these are MOUs between the local school system and those private providers that are participating in pre-K. So they're really not public meetings. They're really work meetings for that collaboration. So they probably are not going to be widely advertised, because they really are to build the coalition and that collaboration between those two disparate systems, the school system and the early childhood system, to work together to implement a mixed delivery pre-K system.
Thank you. All right, 1.1.5.
So this is, I think, where a lot of the questions are really being raised around the high quality standards that are required to meet the blueprints requirements and to receive public funding. And so starting with 1.1.5a, there's a requirement that teachers hold state certification in early childhood, or a bachelor's while they pursue alternative certification. So at least a bachelor's. And you can see the star there is in fiscal 26. So if I counted right and have my dates right. And so that is a requirement that begins in the 25-26 school year. And that date is specified in the blueprint. And the related requirement is that in each classroom, there's also, so in each class of 20, maximum of 20, there's one teacher who is either certified or has a bachelor's degree and is pursuing certification, and one teaching assistant who will have either what's called a child development associate certificate or an associate's degree. Both of those requirements begin in the 25-26 school year. But obviously, there's a need to be working on that far in advance with your pipeline so that private providers and public providers can meet that requirement by the 25-26 school year. And then below that are a number of other quality requirements that take effect as with the new funding formula and the receipt of the public funding under the program. And so you can see in C, high quality professional development, in D, salaries and benefits that are comparable to the school system, and that applies to the private providers. As I just said, in E, a child to staff ratio of 10-1, with those two, with a maximum of 20 students, and then the minimum of the teacher with the qualifications and the teaching assistant starting in the 25-26 school year. The full day program is 6.5 hours long. So every program participating has to meet that. And also inclusive of children with disabilities, as we've discussed, offer curriculums and learning environments that are aligned with the state standards, individualized accommodation supports for all students, evaluations to ensure continuous improvement. I'm not going to read them all to you. You can see there are a lot. And then the last one in N is deals with the EXCELS program. And this is Maryland's early childhood quality rating system. And so the requirement is that private providers and public providers have to reach a level 5, which is the highest level, within 5 years of beginning to participate in the program. So the requirement begins in fiscal 23, meaning that the clock starts ticking and providers have 5 years to get from where they start, which has to be at least a 3 for the private providers and a 4 for the public providers. They now have 5 years to get to a level 5. And EXCELS, many of the requirements of EXCELS are sort of embedded in the blueprint, but there are also many others that are not, that are part of the EXCELS program that MSDE administers. And let's go to the questions.
Well, I was going to actually suggest, Rachel, why don't we do 1.1.6? I think they're pretty combined. And I think a lot of your questions are combining both the actual program and the people.
Yes, you're right. That's excellent. So 1.1.6 really addresses how we're going to increase the number of high quality teachers and staff, and also the providers. So the staff have to achieve certain credentials, and the provider as a whole, or the center, have to meet certain accreditation requirements. So it's sort of it's a two level process, and there's a number of programs in the blueprint that provide funding to support particularly both child care centers and also individual staff to staff up or to improve their quality so that they can participate in the publicly funded system. And so you can see in 1.1.6b is $1 million annually for the Child Care Accreditation Fund to help support the accreditation costs for child care providers. 1.1.6c refers to the Child Care Incentive Program and mandated funding that helps support providers the costs of quality materials that are needed for the program. There's also the Child Care Credential Program that helps support training for staff to achieve additional certifications through bonuses or reimbursements. There's also the another program that falls under the Child Care Career and Professional Development Fund that helps cover the cost of tuition and fees and other costs related to the certification requirement, and also for the teaching assistant, the CDA or AA degree. And then in F is support for providers to increase their Excels rating by receiving a bonus as they participate in the program and then move up in the program. And then the last item there is just a primary contact in the Office of Child Care that MSDE has already done that. And you can see in almost all of these cases, there's a star in fiscal 22. The funding for these programs began in some cases also in fiscal 21. So there could also be a back arrow there, but it's a little hard to put a star and a back arrow. So, but there has been funding provided for a couple of years to support these programs to help providers meet the quality standards in the blueprint. And very quickly, I'll do 1.1.7, which is really just the reporting requirements for MSDE and for the ongoing reporting requirements for Departments of Social Services and Health, and then also the LEAs and MSDE reporting annually on provider participation rates. That's everything in 1.1.
Sounds great. There are several themes that have come out of the chat. So I'm going to try and work in some themes. And then if there's anybody who feels that their questions are not answered, feel free to come on camera and unmute yourself and ask your question or put it back in the chat. There were several questions with concerns just about both the amount of time, effort, stress on the system that it will take in order to have teachers and assistants meet the qualifications. And so there is a general request for more time for our professionals to be able to meet those high quality standards, in addition to a suggestion for additional support, structural supports like substitutes or offering scholarships. One of the themes that several participants noted was the potential for especially for us to lose diversity as we raise these standards, because it would be difficult for some of our communities of color to be able to effectively meet those standards while also meeting the requirements of their job. So I'm going to pause there and let you speak to that for just a second.
Rachel, did you want me to talk to that a little bit about that?
Sure. I think it'd be very helpful, Stephen, if you could talk about what is already sort of in process.
Great. So just a quick note of clarification. While the blueprint does have requirements for teachers and for assistants, as are spelled out in the document you see on your screen, 1.15A and B, and starting in 26, actually the regulations, COMAR, requires a teacher to have a teaching certification and a bachelor's degree, and then the assistant to have could have a CDA, but is not required to have a CDA until later on in the blueprint year. But they could also have a high school diploma. So this does raise the qualifications for the teaching assistants. Right now, we offer through MSDE financial support for any childcare staff member who wants to earn the CDA. We'll pay the portfolio and assessment costs of that. There's a coach that supports folks in getting the CDA. We also have our Child Care Career and Professional Development Fund that provides funding for all the educational expenses, books, tuition for anyone, any child care staff member that's participating at least a level 2 in the Child Care Credential Program to get to participate and get that tuition and books and educational expenses covered to get their associate's or bachelor's degree. And we're working with colleges, community colleges, to offer eventually an alternative preparation program. So that's really would be helpful for childcare providers. And we also worked with Copland University over the last couple of years as they developed a Bachelor's of Science in Early Childhood that is completely online. So it can meet the needs of childcare providers and early childhood educators given their time schedules. We have the Child Care Credentialing Program, as Rachel mentioned, which incentivizes child care staff to earn to take more professional learning opportunities. It could be degrees, doesn't have to be degrees. It could just be lots of different units that enhance their skills and knowledge to provide high quality early learning opportunities. And we also have, for the program aspect of improving the quality, these bonuses that we've done a couple times, but not every year. And we're looking to increase the value of those bonuses so we can support and incentivize programs to get to higher levels of quality. And Maryland excels, which has levels 1 through 5, 5 being the highest. Oh, another thing, because I did see a comment about comparable salaries with schools compared to the childcare programs, the private providers. One of the requirements in these elements, structural elements for the private provider settings, and we have the funding to do this in the grants that we give them, is to provide comparable salary and benefits as to the schools. So the structure of the program is designed that way with funding to make provisions of comparable salaries for private provider teachers and assistants as we have in the school system.
Thank you for that. And then there was a clarification question. For a family child care provider, does the person only need a CDA?
No, all teachers in the pre-K programs in Maryland would funded under the public pre-kindergarten program in the blueprint would need to have a Bachelor's of Arts and a teaching certification, or a Bachelor's of Arts and be enrolled in an alternative preparation program or traditional preparation program.
Thank you. And related to your question about the $60,000 for a starting teacher versus $60,000 for a starting teacher in a private, there was also a comment that the per pupil allocation may not be sufficient for small businesses who don't have the economies of scale that a school system would have, and had, just wanted to elevate that it may be great for a large system, but may not be sufficient for a small pre-K. I don't know if anybody private pre-K wants to answer that.
Well, I'll just say one thing about that. And we have been working for the last 3 years to support our family child care community in building their competencies and knowledge and supporting them in getting higher degrees so that they can be ready for this. We've also looked at ways in which we can examine our regulations to provide pathways. But it is a little more challenging, as you said, for a family child care provider. If they're limited to 8 students unless they're a large family provider that have 12. But what we'd also want to talk about and make clear is that the pre-K is not the only funding source for private providers. We also have our child care scholarship program where we've increased the provider reimbursement rate, and we've increased income eligibility actually higher than the pre-K program. So a private provider could have some children that are private pay, that are higher income, don't qualify for pre-K, don't qualify for the child care scholarship. They could also have some children, especially younger than 3, that are on scholarship and receiving that financial support. And then they might have a few children that are in the state pre-K program. So for private providers, they have some options of combining different public support funds.
Thank you. The other thing that I want to highlight is comments that we've heard before, and one of those is that as we start to expand the 3- and 4-year-old programs, that for our private centers who then have newborns and the 3 and 4s, the impact that may have, because it's more costly to run centers that have newborns in it, that if we start to peel off some of those 3- and 4-year-olds in pre-K programs as they go to public schools, that would make it difficult for our private providers to continue to stay open.
Yeah, I think we have to always be thinking holistically about our early childhood system. So it's not just the 3-year-olds and 4-year-olds that we want to provide high quality early learning and development experiences, but it's also those younger than 3. And that's why we've increased the provider reimbursement rate, or the value of those scholarships, over the last few years. The legislature has taken some really bold moves. When I first came into my position at MSDE, the provider reimbursement rate was only around 9%. The governor increased it to 20%, and then a law was passed in the legislature. So we went to the 30th percentile of provider reimbursement rate, then the 60th percentile. And now with the American Rescue Plan Act of 2021, we've increased that to the 70th percentile. So as we've increased that, it better helps providers in accepting the cost of care. I think we always can make improvements in that area. But I think, again, we have to think holistically about the entire system so that we don't have any unintended consequences.
Thank you for that. Another question that came in is, will there be any language to sharpen the definition of comparable salaries and benefits? I'm a public school kindergarten teacher making $62,000 a year next year, whereas my wife is a public school pre-K para scheduled to make $29,000 next year. We have pensions and healthcare plans, just looking to ensure some parity across systems.
So
I think that might be more a question for Rachel, right?
So I think big picture, the new funding formula for pre-K was developed based on the cost of quality standards that are being required. So the per pupil amount that will be provided for each full day pre-K student is it phases up, but to about $22,000 per full day pre-K student. And so within those monies are, at least arguably, funding to support the salaries that are required and the other high quality standards that need to be met in order to participate in the publicly funded program. There certainly are fair questions about scale. And I think part of the purpose of the MOUs, at least in the commission's work and the blueprint, was, because the LEAs obviously have the scale. And so the whole part of the point of having the MOUs between the LEAs and the providers was to sort of work out how to leverage the scale that the LEAs can achieve with the private providers. They need each other. I mean, the whole system was designed that they need each other. And so they, to work together to resolve, I mean, I'm not saying it's easy. I mean, all these questions are pointing out the very hard work that is going to go into making this work. But if we're going to have a successful mixed delivery system, then that's what needs to happen. And hopefully we can maybe use our next working session on Pillar 1 to start to talk about, and I've seen some things in the chat where folks are talking about what they've done that's worked for them and how they've been able to start to move towards participating in the publicly funded system, and see if we can, to use the word, elevate some of those as models as other systems and providers are trying to figure out how to make this work. And I did see another, I mean, there's some really good suggestions in the chat about, I think, and it overlaps with Pillar 2 in terms of the teacher pipeline and teacher shortage, but trying to get more programs available online, not just for the BA program, but also for the CDA certification, and also thinking about how to support teachers who, essentially are upskilling, that are already, working at a childcare center and want to meet the higher quality standards, but how do you do that while you're working full time? So sort of trying to think creatively about how to start to address the many challenges that are involved here.
Thank you. I think we've seen some themes here. So I think that those themes are things that we will want to come back to. I think that we could probably spend another 2 hours going through and just sort of diving in. But I'm wondering, again, if it's better if we we've identified some of those themes, if we take a deeper dive in our next meeting, and if we try to move forward to take another look at some of these other, just so that we have a general understanding of what our timelines and our tasks are for all of this entire pillar.
Sure. So very quickly, because we are almost out of time, I will just very briefly. The kindergarten readiness assessment is the next objective. And, we want to support all of our young families and children, but in the Blueprint context, all of these supports are intended to help students come into the kindergarten, into the public school system, ready to learn. And so that is the kindergarten readiness assessment is intended to assess the readiness of the 5-year-olds as they come into the public school system. And you can see under A through G are the various requirements that are in the statute for what we call the KRA. And there are stars in pretty much all of them in fiscal 23, so this upcoming school year. The KRA has been given for a number of years in different, slightly different formats, and not necessarily given to all incoming kindergartners. So one of the requirements under the Blueprint is that school systems have to administer the KRA to every incoming kindergarten student, and that the KRA will be unbiased. And the law requires that MSDE look at the assessment and determine that it is unbiased, and if it isn't unbiased, to modify it before administering it under this requirement. And then you can see the timing of is by October 10th. That the LEAs are required to consult with teachers in determining how to implement the assessment. That pretty much, I mean, there are other things there, but you can see that. And then the next task related to expanding family supports, really revolves around a couple of key provisions. The first is to expand the family support centers that are now called PATI centers. And these are for the family supports and interventions. And also family support centers actually are service delivery as well in the 0 to 3, potentially longer than 0 to 3 space. And you can see the back arrow indicates that funding has been provided prior to fiscal 22 to support this expansion as part of some of the Bridge to Kerwin laws. And then in 1.3.2 is the expansion of the Judy centers, which are the coordinating entities more in the 3 to 5 year old space to coordinate meet the needs of families and coordinate service delivery. And you can see, again, there's a really significant expansion of Judy centers, 135 new Judy centers over the next 10 years. And then in 1.3.3 is fully funding the infants and toddlers program, which is the state's early supports and interventions for students who need them in the early years. And funding is more than essentially doubled for this program over the next 10 years to meet the needs of all the young children who have needs. And that covers everything, so to speak. There's a lot of subtasks that we aren't even, this is complicated.
Thank you for going through that, Rachel. And I think we'll have an opportunity to dive in a little bit deeper. Somebody had asked whether or not the KRA will be administered in multiple languages. We are running out of time, so I'd like to table some of those questions for the next time that we dive in and throw it back over to our chair for any closing remarks. I do want to thank everybody for your participation today. I've taken copious notes. We will be capturing the chat as well, and we will continue to have the conversation. So if you don't feel like your questions were answered, please know that we will, we have captured them and we are thinking deeply about them. And with that, I will pass it back to the chair.
And thank you, Jennifer, and thank you for your leadership today and going through all the questions and facilitating our meeting. Thank you as well, Rachel and the staff, and for all of those who participated in today's session. As just indicated, there are a number of questions that still remain outstanding. Hopefully, when we get to the smaller group sessions, we will look at those as well and come back at a later date and provide some additional answers in response to those as well. Keep in mind, we will do nothing without having an open session to discuss it. So our transparency is there, and we will honor that process. Rachel, are there any remaining questions or issues or comments you'd like to make before we close out for the day?
No, the only thing I will say is that we are at least tentatively scheduled to revisit Pillar 1 on August 18th at 1 p.m. And we clearly have much more to talk about. So I think that is no longer tentative.
Okay. All right, then. Thanks, everyone. We appreciate your participation today, and we'll get back to you as quickly as possible and give you further details about the next meeting. Thank you.
Thanks, everyone.
Thank you, everyone.